Monday morning. Welcome to the CDCS Unbundling Project training. As you may know, we have scheduled 4 different trainings to talk about the CDCS Unbundling Project. They were all identical trainings, so there's no need to attend more than one if you're here today. We have created this particular training specifically for lead agencies and CDCS support planners. My name is Cindy Grebben. I work at the Disability Services Division at DHS. I'm on the Home Care and Self-Directed Services team. I've been at the state about 15 and a half years. A few of those years I worked in DHS licensing, and the remainder of that time at the state, I've been in Disability Services Division, primarily with the assignment of CDCS policy, amongst other things. I also, prior to coming to the state, 25 plus years, I worked in a different method of disability services, and that was residential services. So direct care to director all those years. So I've seen a lot of things over the 40 plus years, but that doesn't mean I have all the answers, and that doesn't mean I know everything, but I have seen a lot, and I have seen some really positive evolution of the services to people with disabilities. I am joined by my coworker, Rebecca Fee, and I'll let her introduce herself. Rebecca?
Thanks. Hi, I am Rebecca Fee, and I work with Cindy in the Disability Service Division at Home Care and Self-Directed Services area. And I've been with the division for a couple of years now. And prior to that, I worked with Clay County and then Becker County for a combined probably 22 years before that. So I'm happy to be here and and learn with you. So a lot of you knew or know Libby Rossett Brown, and she had worked in aging for many years until she retired here in May. And so I just wanted to introduce the person who has her position now, and that is Dawn Clemmer. So Dawn, if you want to introduce yourself and say a few words.
Hi, yeah, thanks. Welcome everyone. My name is Dawn Clemmer, and I am going on week 3 here at DHS as the elderly waiver policy consultant on the HCSB policy team for AASD, so for the Aging Services Program. And I've been learning a lot and really glad to be working with Cindy and Rebecca on the CDCS program and changes and everything that we're presenting today. Prior to my work here at DHS, I worked at Dakota County for 9 years, both in case management, assessment, and then as a supervisor. So I'm excited to be here, and thanks.
Okay, thanks, Dawn. Also, you see on our policy point presentation, Diane Benjamin, she's not going to be able to be joining us today. So it will be Rebecca and myself and Dawn with doing the presentation today. Next slide, a few housekeeping things. So today, we do have all the cameras disabled for a more stable internet connection, and I actually will be turning my camera off too as I start to present. And given the fact that we've had all these technology problems, we want to ensure that everything goes smoothly today. We do welcome your questions. We want you to ask questions. We're going to use the Q&A function on the webinar. So we do prefer, though, that your questions be general. So as you're listening to the things that we're going to be presenting, I'm sure that you'll think about how is this going to affect this particular person or this particular case, but we really aren't going to have a lot of opportunities to get into any detailed scenarios. This is intended to be a high-level introduction to what exactly is happening with unbundling, and just know that we will, our policy pages and different things that will be published as we move forward will have a lot of that detail. We would prefer that the questions be answered after each segment. So we have built into the PowerPoint time after each segment to be able to respond to questions about that segment. It's just a little bit easier to be able to respond to the questions that we just presented on. So feel free to use that Q&A function. We'll do our best to answer questions. If we're not able to answer some of the questions, we'll take that back and be able to look at exactly how we're going to be able to provide that information. Next slide, please. So today our topics will be, what is unbundling? What exactly does this mean? We've been hearing about this for several years. There's been, talk about some of the changes that are going to be coming, and people don't exactly know what this means. Why is it necessary? Why are we even doing this? We'll talk a little bit about why we're making these changes, why we were directed to make some of these changes. The other thing we'll be talking about is how exactly are those CDCS service categories changing. And we think about CDCS and we think about CDCS as being service categories. And we'll talk about how those categories, the current categories that we have, will be changing in the future. We will also talk about what CDCS policies are being clarified or updated. And then finally, we will talk about how and when how we will implement unbundling. How are we going to do this? How is this going to happen? What are the guidelines? And we'll talk about that at the end. Okay, next slide. Okay, what exactly is unbundling? Unbundling really refers to redefining those particular CDCS service categories to keep like items together. So we were directed by CMS to take a look at these service categories that we currently have in place, to be able to really look at why we have things bundled, or they considered it bundled. And the good example, the best example that I can provide is the CDCS service category of environmental modifications and provisions. So CMS said, you have environmental modifications and provisions. The provisions part of that were things like equipment and supplies, adaptive clothing, transportation. And CMS was saying, how does that have anything to do with home modifications? So that was one thing that they really looked at and asked us to do some things differently with CDCS. The next slide, please. So really, here's what CMS kind of guided us to do. So they took a look at CDCS, and they, again, like I said, we're asking us to really define each section, each category. We think about it as a category. They wanted it to feel more like a service, each individual service. So what exactly, what is the service definition for personal assistance? What is the service definition for treatment and training? Really clearly defining those service definitions for each of those categories. The other thing that they asked us to do is clarify provider qualifications. So they wanted us to really look at who's actually providing the service, how is that person qualified, who's doing what, when, how, and who's verifying qualifications, or who's monitoring and looking at individual qualifications to be able to provide that particular service as defined by our service definition. So this really came about because of CMS guidance. They've asked us to do that. The other thing I want to mention too is that this unbundling has already been approved by CMS in our waiver plans. We did have public comment period. It's really been a couple of years. And we had a public comment to amend our waiver plans, and that has already been incorporated into our waiver plans, the unbundling, even though we haven't implemented it yet. Next slide. So right now we have 4 service categories for CDCS. As you know, individuals that are selecting CDCS or choosing to self-direct through CDCS are provided their state set budget. Their state set budget is authorized on a single line item on a service agreement. And when a person develops their plan, they allocate those funds into one of these 4 categories. And the reason that happens that way is to be able to differentiate exactly how people are using those dollars. The authorization will not change. The only thing that will change is how we bill that or report that. The next slide will show you the whole visual of the changes. So right now, as I mentioned, we have those 4 service categories. The 4 service categories are built into a person's plan, and the way that we make that differentiation of how these funds are used is through the use of modifiers. So it's all happening on the claim side, and it will continue to be that way. So when somebody is creating their plan, they put into one of those categories, and then the financial management service provider, when submitting that claim to DHS, will identify which category it was, which category that the funds were used from. So in the future, personal assistance will be personal assistance. That category will not change. Treatment and training will also continue to be treatment and training. The environmental modifications and provisions is being split or unbundled. And this is what I mentioned earlier, where we wanted to keep like items together. CMS has directed us to split up home modifications separate from vehicle modifications. So there's 2 separate categories, one being environmental mods home, environmental mods vehicle. The other category is a new category called individual directed goods and services. And that category, and we'll talk about it in greater detail later, that category will really capture all the things that we are currently allowing under the provisions part of the environmental modifications and provisions. The other category, the final category, is self-direction support activities that we currently have in place. And that particular category has always been somewhat of an administrative cost, right? How much, what portion of that budget is being used to implement that plan? So the administrative costs, the FMS fees, the employer share of benefits, the CDCS support planner, some of those things. And we've been asked to split that category also. We will have a separate category for FMS and a separate category for CDCS support planner. Finally, we have created a new category that is called community integration and support. And we will talk in more detail later about what that actually involves. So this is really the visual of the unbundling. So we have currently 4 categories. It will be separated or unbundled, and it will, in the future, will be 8 categories. Next slide. So this is just kind of a high-level overview or reminder of CDCS, the intent of CDCS. The one thing that we hear quite a bit, we hear, whether it's a lead agency or participants, we hear people refer to CDCS as a CDCS waiver. Know that it's not specifically a waiver itself. It is really just a way for people to utilize their waiver dollars in a self-directed way. So because of that, we always provide that reminder that there are certain things that we have in place to guide us in what waiver dollars can and can't pay for. So a person that's on CDCS is using DD waiver funds or CADI waiver funds or BI waiver funds. So we want to make sure that people still keep that connection, knowing that although CDCS offers a lot of choice and flexibility and different things like that, there's still some parameters around the use of waiver dollars in general. The basic waiver criteria for allowable expenditures is typically where we ask a lead agency to apply while they're making a decision about a requested item. So that means any good or services that waiver dollars pays for must be included in the plan. It must be necessary to meet a need identified in the person's assessment, must be related to the person's disability and or condition, and must be for the direct benefit of the person. Next slide. So this is also part of the basic waiver criteria for allowable expenditures. This has been in place for a long time. And again, this is part of our waiver plans, and this is setting some of the parameters around the use of waiver dollars, regardless if somebody is self-directing through CDCS or not. So these should not be unfamiliar to people because these have been part of our waiver plans for a long time. So we just want to remind people that CDCS or waiver dollars does not cover things that are services or goods that are either purchased or provided prior to the development of a support plan or prior to approval. Things that aren't in the plan, things that are recreational or diversionary in nature, we'll talk more about that later. Items or support that's for comfort or convenience, things that maybe duplicate other things in the plan, substitute for natural support. And the next one of those ones that probably is applied quite a bit, that are things that are not the least costly and effective means to meet the person's needs. Things also that waiver dollars should not pay for are items or support that are available through other funding sources. Waiver dollars also do not pay for the cost of educational expenses or pay for the cost of utilities. Next slide, I think we have questions. So Rebecca, do we get any questions?
Take a look here. I don't see any yet. So maybe we'll give people just a minute here to, if anyone has questions about what you just went over. I don't see any currently.
Okay. Okay, well then I think we will move to the next section, and that will be personal assistance, and Rebecca will be covering that section.
Okay. Yeah, we'll go ahead and get into it. So for personal assistance, all right. So personal assistance, one of the things that we're doing, like Cindy said, the category is not changing, but there will be some updates to the personal assistance page of our policy, online CDCS policy manual. And these are nothing really new. These are just clarifications and updates. For example, the direct assistance. Okay, so personal assistance is direct assistance provided in the person's home or community. And so we're really just kind of clarifying that these are folks that are hired by the person to provide direct support. But we're also clarifying what support they can provide. So we're defining the activities of daily living specifically, which are bathing, grooming, dressing, toileting, positioning, transferring, mobility, and eating. So that will be on the page. Instrumental activities of daily living is defined and will be on the page as activities that include meal planning and preparation, paying bills, shopping for food, clothing, and other essential items, and performing household tasks that are integral to the personal assistance service. Caregiver relief is defined as a break for a primary caregiver while the person is receiving support from another worker. And then, as I mentioned, we're clarifying that this category is for costs related to directly hired employees of the person and providing direct assistance. One of the areas we did also update, though, is worker ratios. So, for example, a person might need 2 workers to assist them. In a situation where they have a need assessed need for assistance by more than 1 worker for a period of time or for a certain need to be addressed. Now, one thing that's that's not changing as well is if one worker is providing support to more than one participant, that is still okay as part of a shared service situation where you may have up to one worker can care for up to 3 individuals that give that consent. So that's still happening, but we're just adding information to clarify that there could also be a situation where more than one worker may be needed for one participant. All right, so next slide. Oh, there you go. Also, what is new? So since there is no longer a place to put employer-related costs, which were previously in the self-direction support activities, which you saw earlier, is going away. Those costs need to be moved somewhere. So they're being put under the personal assistance category. So that personal assistance category will include the costs for directly hired workers and the related expenses. And next slide. Okay, some additional updates. These are not changes to any policy. These are just things that weren't on the page currently that we felt should be. So we get a lot of questions about bonuses to directly hired workers. And so we wanted to just provide just a few more guidelines, not hard and fast rules, not must-dos, but just some things to think about when considering bonuses for directly hired workers, because we get a lot of questions about that. Also, things to consider when thinking about worker wage rates, which is another area we get a lot of questions about. Thought that you guys would like to have a little more information about how to make those decisions or things that could factor into making those decisions. And then also just to remember that waiver policy overall says that, direct support services cannot be provided out of the country and be paid for out of the country. And so this is just a reminder, we added that personal assistance services are also direct support services, and workers cannot be paid while traveling out of the country for them as well. And next. All right. So another little policy clarification. Again, this is not new policy, but we're just making sure that we're updating the pages to indicate that non-covered services under personal assistance would be those services that function solely as a substitute for childcare, but those are not covered, along with services and tasks that a spouse or parent of minor is typically responsible to perform. And then again, services to the person while they travel outside the country. And then we're also just providing clarification that the person or their representative cannot reimburse themselves to provide administrative support. So developing and administering the plan or hiring, training, or managing workers, the person or their representative would not be able to be paid for those duties. And next slide. The other thing we have to update is the provider qualifications. So on here, there's a couple of things that are the same, and then there's a couple things that we had to add. So it's still the same that all the workers need to pass a DHS background study. The workers still need to meet all the Minnesota Healthcare Program individual provider enrollment requirements. Okay. And receive individualized training from the person or their representative. So basically, we're just wanting to make sure that the workers are qualified to do the job they're being hired to perform. And we added a little bit more information on being able and willing to provide that service as outlined in the person's plan. So an example would be if a person would need help with morning grooming tasks and the person that they want to hire is only available in the evening, that this might not be the right choice. The person should also have the ability to communicate, the ability to perform the tasks they're hired to complete. So we've just provided some more information on the policy page as to what does it mean to be able and willing to provide that service related responsibility. And then one thing that is newer is that personal assistance workers will need to follow the same incident reporting and manual restraint standards that are in place for other direct support workers. And there will be more information coming out on that when the pages publish. And next slide. All right, so we have some opportunity for questions here. If you'd like to throw some in the chat, I think there maybe some already. Cindy, what are you seeing?
Yeah, Rebecca. So the one we do have a question about do we have an estimate as to when these changes will go into effect? And as I stated earlier, we are going to talk about implementation at the end of the presentation about how we're going to do this and when we're going to implement and roll it all out. So we will get to that at the end. The other question, Rebecca, is just kind of a scenario, but I think it's a good question. If an adult participant is not able to do their own shopping or meal prep, can a direct staff person be paid to do these tasks while the participants at a day program or somewhere else and not with direct staff? So I think that's in relation to personal assistance.
Yeah.
Helping with ADLs and IADLs.
Let's see, while the person's on different. Yeah, that gets tricky. It gets tricky because of, you know, what the billing rules and things around having multiple services working at the same time. And maybe Cindy, you have more experience on those than I might. So if you have anything else you want to mention.
Yeah, I mean, I think that's one question that comes up with our OIG or like fraud investigators. They're questioning two waiver services at the same time. And I think if you want to submit a question to our DSD contact form, we can delve into it a little bit more, but this is more of a case-specific kind of a thing. And I think your question is, how is the personal assistance category changing in relation to the scenario that you're asking? So if you want to do that, we can answer a little bit more thoroughly on that. Okay.
Well, actually, I think the email is at the end of the presentation, and so that you can use that email.
Yeah, we'll get that email. The typical DSD contact form that we'll request. That's kind of a preferred way to get in and ask questions. The other question is about clarifying the out-of-state vacation parameters, and maybe we can put in I'll grab that. I'll grab the link to the policy page. It's waiver policy. It isn't CDCS specific, so we will grab that link and put it in the chat. It's not CDCS policy. The other question, are the incident reporting and manual restraint standard referring to 245D regulations? So as Rebecca mentioned, we are going to clarify more about the parameters around incident reporting and use of manual restraint as we move forward with implementing unbundling. We just wanted to let you know that that was added to the waiver plans under the provider qualifications for personal assistance. Oh, the next question, Rebecca, is will behavioral regulations still be covered under personal assistance? I'm not sure I'm understanding specifically.
I'm not sure either. I'm wondering if it kind of refers to the 245D stuff. So Rice County, if you want to send that in, and we can get some specific, try to have some back and forth on exactly what you're looking for there. But again, the incident reporting manual restraint standard discussions and a policy related to personal assistance will be coming. We just wanted to give you kind of a heads up that things were changing. Yeah, behavioral regulation responses assistance, they're just following up. Yep, those are the kinds of things we will be clarifying in policy for personal assistance going forward. Is there anything else you want to mention about that, Cindy, or is...
No, not really.
Okay.
No, yeah, I don't. There aren't any other questions.
Okay. So we'll just keep on going here to treatment and training is the next category. And just like with personal assistance, treatment and training is not changing in terms of the name, the category. And but it'll be it'll look a little different. So treatment and training under covered services will include specialized therapies, behavioral supports, and then also training and education for caregivers and for the person. These are the only services that will be covered under treatment and training. Okay, next slide. So specialized therapies and behavior supports are services that a Minnesota healthcare program medical provider has prescribed to relieve the person's disability and or health condition. So because there had been a lot of confusion about treatment and therapies, etc., we clarified the service definition of specialized therapies and behavioral supports and added that definition to our federally approved waiver plans. And next slide. Now, as before, specialized therapies and behavioral supports must meet all of these criteria, and the criteria are still being prescribed by the medical provider licensed to practice in Minnesota. It must be a physician, a physician's assistant, or an advanced practice registered nurse. The specialized therapy or behavioral support being prescribed must not be available through other funding sources such as medical assistance. A waiver would be, or a traditional waiver services would be another example. And also it must relieve the person's disability and or condition. And because there has been some confusion surrounding what that means when a service is not available through other funding sources like MA, we will cover that in a greater detail in a different slide. And let's see here. Yes, and so what does a person need to do to access this? Well, in order to access these specialized therapies or behavioral supports under treatment and training, the person would need to ask their medical provider to complete and sign the form indicated. Now, currently, there is the alternative treatment form. We will be replacing that with new forms, which include the two listed here. So CDCS Specialized Therapy Request Form, which is going to be the DHS 5788, which is currently the number of the alternative treatment form. So it will change to become Specialized Therapy Request Form. And then we've added the CDCS Behavioral Supports Request Form, which is the 5788B. So the medical provider would need to fill out and sign the form, and then the person would submit the signed form to the lead agency for review. And then those forms will have the information, some of the information the lead agency would need to consider to determine whether or not CDCS can fund the service. And then, as I mentioned, the CDCS alternative treatment form will not be used during unbundling or after unbundling. Let's see here. And then the next thing. So when we talk about training, these are pretty much unchanged as they are right now. So the training and education for paid and unpaid caregivers are still services that pay for the training and education to support the caregiver's ability to care for the person. And then the training and education for the person is still services that pay for training and education to increase the person's ability to manage their CDCS services. And next slide. So the non-covered. So just want to point out that this section is specifically about services. And one of the things I want to mention is just that we've clarified on our page that the non-covered services are items or goods. So treatment and training wouldn't be for an item or a good, it would be for a service. So it's either going to be specialized, therapies, or it's going to be specialized behavior support services, not specific items or goods. And that's been kind of a confusion in the past, so we're clarifying that. And then it's always, been the case that we've never been able to cover experimental treatments under this category, or fees incurred by the person for, say, MA fees or copays. Prescriptions, over-the-counter meds, compound solutions, related fees are not covered. Service animals related costs, medical treatment or services that are available through other funding sources that include other funding sources like MA or traditional waiver services, and medical treatment or services that exceed current MA coverage. So just again, I want to just reiterate that what we're talking about here are treatment and training category, and we're talking about services. So when a person is in need of a service under treatment and training, that service should not be something that's is available through other funding sources. So it wouldn't be a behavior service that is already covered under traditional waiver service, for example. It wouldn't be a behavior service that's already available under MA, for example. It wouldn't be, things like, we'll talk about here about say, person wanted more chiropractic visits than they're going to get. That would be something that wouldn't be allowable as to be paid under treatment and training, because that's a service that's covered under MA. And we'll talk about that a little bit more in greater detail later. Okay, next slide. So provider qualifications for the treatment side of this treatment and training. So specialized therapies and behavior support providers need to be certified or licensed according to state law related to the service that they're providing. So an example of this would be hippotherapy. So hippotherapy must be purchased from a provider who's certified by the American Hippotherapy Certification Board. So for example, sometimes, although it may be therapeutic for someone to, say, visit like a ranch or a hobby farm to feed horses or pet horses or participate in just being around horses, and maybe that might be therapeutic for some people. However, it would not be considered hippotherapy because that farmer or rancher maybe did not have a hippotherapy certification and would not be a hippotherapist. So that would just be an example. And next. For training provider qualifications, so training and education providers must have their relevant professional licenses, credentials, or certificates that is required by the state law. And if there's a training and education that does not require professional license, credential, or certification, then the person can define the qualifications that they want the trainers to have, and they can define those in their CDCS CSP. Next. Okay, and then also unchanged is our verification of provider qualifications. So this has kind of always been this way, that before the person receives a service, the case manager verifies the provider holds the license, credential, or certification required by state law for that service. Part of this is also ensuring the provider has not had state or county agency contracts or provider agreements discontinued due to fraud. Ensuring the provider has not been disqualified under the criminal background check according to the standards in the statute. And if state law does not require the provider of the service to hold a license, credential, or certification, then the case manager verifies the provider meets the qualifications that is defined in the CDCS CSP. Now, the person must maintain documentation of the provider qualifications. And so, we have been working on and updating the treatment and training pages. And in these requirements have always been the case, but we just have not been, had them as, it wasn't as clear in the leading agency operations manual or in the online pages that we have. So we're updating that. And next slide. So we said we would talk a little bit more about available through other funding source, and I just want to reiterate that the context for this is related to treatment and training and related to services that a person may want to include under the treatment and training category. So basic waiver criteria does say that an item or service can't be funded with waiver dollars if it's available through underfunding sources, excuse me. And so as I kind of touched on before, if a person is unable to find a chiropractor in their area that accepts medical assistance, waiver dollars would not be intended to replace health insurance coverage, and the person would not be able to put those additional chiropractic visits or replacement chiropractic visits under treatment and training category, because there is coverage for the chiropractic visits through MA, even though the person may not be able to find a chiropractor, down the street, so to speak. And then I want to reiterate too, before maybe we get a question on this, but just to again mention that we're not talking about supplies, we're not talking about goods here, incontinence supplies and things like that. We're just talking about services under treatment and training, and when they can be funded, and when what it would mean if another funding source would be able to cover that. And it's time for questions, I think. So we'll take a look at those. Cindy?
Yeah, we have some great questions, Rebecca.
Okay.
So the first question is, the first question says, hang on a second here. Okay. Oftentimes we have individuals note if they receive outside therapies like OT, PT, EID, BAI in this section, treatment and training section of their plan, even though it isn't something they're using their waiver or CDCS funds to pay for the support. Rather, it is just more to note a fuller picture of services and supports. Should we not continue to do this, or is it acceptable? Do you want to take that?
Sure. So one of the things we haven't really mentioned yet is that we are working on the new CDCS CSP. That, of course, will have to be able to include the new categories and the splits and things like that. So I think what you're asking is, how do we note in the plan, or how do people put, what other supports they're receiving, so that we can get a good picture of how the person is getting their needs met, even if they're including waiver services and MA funded services and maybe other kinds of support. And I think the answer here is that this is more of a plan question. So of course we think that those things are good and important to know, and certainly can't think of any reason that they don't need to or couldn't be in a plan. But I think it would be best when the plan comes out to have kind of addressed that kind of question. I don't know. What do you think, Cindy?
Exactly. We've always said that in order to get that bigger picture of supporting individuals, it is recommended that plans do include some informal unpaid support in order to really capture that the supports that people are getting, whether it be paid or unpaid informal, are meeting needs. So nothing's really changing about that. I think that that's still acceptable to be able to. We do see that on plans, and it'll just say $0.
Yeah.
Okay. The next question is, if it is being recommended by a physician, meaning that therapy, wouldn't it most likely be covered through MA? Can you give an example? So I think what the question is that when we talk about the use of waiver dollars again are intended to supplement and or complement what is available under state plan home care or state plan health insurance, right? And so sometimes we do hear about people saying there's a medical necessity for this, the doctor saying it's medically necessary for something, then that really does need to be addressed through health insurance. And if there's a question about MA not or MA denying something, then that person needs to address that with the denial with MA. I think that's kind of what you're getting at. The physician saying they need this service, and it should be covered through MA, and there could be a denial of it, but that doesn't necessarily mean that waiver dollars pays for it. Anything else, Rebecca, on that one?
No, I mean, I think that's what this is referring to. You know, but and I guess another example though would be if it's being recommended by a physician. Well, if HIPAA therapy is being recommended by a physician, MA still isn't going to cover it because it's not a covered service. And so we see a lot of, you know, HIPAA therapy for that reason, I think, in CDCS plans. So yeah. So I guess I'm just saying that, you know, the thing to remember is just what does MA have coverage for? You know, so some of the things, I don't know. I guess I'm trying to think of what might be a covered service under MA, like chiropractic visits, for example. I guess we've been using that one a lot. If a doctor's recommending chiropractic visits, then, you know, we know MA has coverage for them. And so that would be sought through MA. HIPAA therapy doesn't have coverage under MA, right? So that would be something that would go under treatment and training if a physician prescribed it, recommended it. Hopefully we answered that. If not, submit more details on the contact form at the end here. There more, Cindy?
Yes. So the next question, are BCBAs able to be MHCP enrolled providers without being part of EIDBI? And that is really an enrollment question and not necessarily part of CDCS specifically or our unbundling. That would be something you'd have to go through the MHCP enrollment area to find out about enrollment requirements. So the next question is, when MA providers have extensive wait lists, is it appropriate to use funds to pay for a non-MA covered provider? I'm going to jump in if that's okay, Rebecca.
Go ahead.
Okay, so this is, I think, one area that there's been some confusion about, and that's because we have people that have, let's say a preference for a particular medical provider or an OT or a speech person or something, and they say, this particular person specializes in working with kids with autism, but it's not available under MA, but that's because that provider is not an MHCP medical provider. Waiver can't pay for that because the person still has coverage for that service. The other thing too that I would, we could have more discussion about this, but the other thing too, if they're not MHCP enrolled provider and you're talking about authorizing a medical expense, medical service, there wouldn't be any oversight, DHS oversight at all. So this might be a bigger discussion, but I'm also, I know that if you're not going through medical assistance or billing through MHCP, I would be concerned that there wouldn't be any oversight of DHS because people are billing through an FMS. So you wouldn't even know if that person's, nobody's vetting that non-MA covered provider. Hopefully that answers the question. Okay, the next question, Rebecca, is therapeutic writing is different than hippotherapy and there is a PATH certification. Would that be allowable?
You'd say that that's up to the doctor and the case manager,
yeah.
Right?
Yeah, I think that's real, that is a case specific thing. I think what we were trying to say is that somebody providing therapy needs to have the credentials to provide therapy. I think that's the general. It wasn't just hippotherapy, but anybody that is providing a therapy service needs to have the certification to be able to do that. And the example that Rebecca gave was somebody, going to the farm to pet horses. So yeah, I think you're on the right track with that question. The next question, okay.
Yeah, the next question. There was questions about how providers check things. The question was, how do lead agencies check to verify providers haven't had? So I guess the only thing I want to say to that is that counties have been doing this for a long time. The approval options, there's a lot of services that a county could choose to use a non-enrolled provider to perform if they go through the approval options, checklists and contracts, and the instructions for how to do these should be on those pages. So hopefully that will help. If you're unable to find that, please reach out to us and we will get that to you. What else, Cindy? Is there? We take another maybe one more before we move on.
There's another, and this is the clarification that we are attempting to add to policy pages when we talk about not available through other funding sources, or when we know that waiver dollars can pay for equipment and supplies, for instance, that aren't available through MA. That's something that has always been available to people. So the question is now this is talking about services. Is it also a limit now that CDCS funds cannot be used for additional services such as chiropractic above what MA would cover? Waiver dollars aren't intended to pay for medical services. So when we have questions that'll say, my coverage for my health insurance only allows for payment of, 2 dental exams and cleanings a year, but I need more than that. Waiver can't specifically pay for that. And that is because if those, whatever limits that we all have limits, we all have parameters around our health insurance. If we go to out of network, or there's certain things that all of us have under our health insurance. So if waiver dollars wasn't intended for waiver dollars to pay for like an extra cleaning, a medical service like an extra cleaning or extra, chiropractic or whatever that is. That's not how it's worded. What's worded is talking about being able to cover equipment and supplies and things that are not available through MA. So hopefully that answers the question.
And then I think I'm seeing there's a lot of real specific things like music therapy is psychiatric care. I think, if people still have questions, feel free to send them in for specific things like this, but we're going to try to keep moving only because we have so much to cover yet. But we certainly invite you to the email or the web content form at the end. And we'd be happy to respond to those individual questions.
Right. That sounds good. And okay. All right. So our next service category is individual directed goods and services. Next slide. So as I mentioned earlier, when we first started, this is a new service category, and it really allows people to use their budget for some of those items that were previously covered under the provisions part of environmental modifications. So there really aren't going to be a lot of changes for people. When we think about how is this going to impact people, what individuals really want to know is whether they can get some of the items that they had previously been able to get, and they're not as concerned about which category it goes in. They just want to know that they're going to be able to get it. And so you'll see that under individual directed goods and services, it really is going to cover some of those things that have already part of waiver and CDCS. Things like equipment or supplies not otherwise provided through waiver or Medicaid state plan, something we just mentioned. The other thing about individual directed goods and services is that we actually used the CMS definition, and they had created this service called individual directed goods and services. And so we really modeled our category after exactly what CMS has in place for guidance for us and other states. And so services under this category must decrease the need for other Medicaid services, promote inclusion in the community, and increase the person's safety in the home. And those are very general concepts. But the next slide really will outline some of those things that you are all familiar with. It's going to cover some of those supplies and equipment, including assistive technology, as before. Transportation, we know that under CDCS, people can pay their workers mileage to be able to access the community. The one thing that we know that people are using are home care services performed by independent contractors. That is something that is pretty common for CDCS, and that will continue as is. Nothing's changing, but we will have people put that home care services performed by independent contractors under individual directed goods and services. So this is where it'll go. The next item are environmental support. So under individual directed goods and services, you're going to be putting some of that, house cleaning, chore, lawn mowing, snow removal, all those things that people had in their plans before, but it'll go here. The other thing is health clubs or fitness members for adults also will go here. Adaptive clothing, part of the current policy, it'll go under this category. Extra costs of additional specialized foods for a prescribed diet, as it is now, it will go under here. I do want to mention that we do have we did create a separate form for the specialized foods, additional specialized foods for a prescribed diet, and that is DHS 5788E. And as Rebecca mentioned earlier, we took that alternative treatment form and we really kind of split it into three to be very more specific to the service that people were requesting. The last one are modifications to recreational items or activities, and we'll get into a little more detail as we move forward. Next slide. So some of the things, these are all things too that are not new. It's just a reminder of different things that aren't covered under individual directed goods and services, things that you're familiar with. The prescription over-the-counter meds aren't covered, room and board, personal items, some oral nutritional products. Nothing's changed with this, just so you know. It's just how we had to put it on the policy page. The CMS really asked us to split out some of this stuff into each category and talk about covered and non-covered. So this is just where it landed. Items that do not provide medical or remedial benefit to the person. Utilities. The biggest change that will impact people is the fact that CMS has directed us that we can't use 1915C waiver dollars to pay for internet access. This will impact people. Out of everything that's happening with unbundling, this will impact people, and it's really because CMS has directed us that we can't be using these waiver dollars to pay for internet for individuals. The other thing that we currently have this on our policy page, and it's kind of applies to other traditional waiver also. Waiver dollars don't pay for items that restrain the person or restrict their rights. Waiver dollars don't pay for tickets or related costs to attend sporting or recreational events. And as I think this was on the other one, to general basic waiver criteria, animals, including service animals and their related costs. So not all of these things are things that you should be familiar with. The biggest impact, obviously, as I mentioned, is internet. Next. So the next part is really talking about individual directed goods and services related to recreational and diversionary. So as we know, the CMS has said that waiver dollars can't be used for goods that are recreational in nature. And that this has really been part of our general waiver criteria all along. And it's in our federally approved waiver plans. And there's also a 1915C technical assistance guide that has been published by CMS that provides states guidance on developing their waiver plans or amending their waiver plans, and that is specifically called out in here too. We know that this has been challenging for people to interpret exactly what is recreational. This varies across the counties and the agencies on how exactly they determine what items are recreational and what exactly can be covered. And we know that our current policy hasn't been clear on how to evaluate what waiver dollars can pay for. So we're hoping to clarify that policy to be able to assist lead agencies in evaluating. When we talk about our guidance that we provide on any of this, the guidance that we provide are considerations for the lead agency when presented with a requested item. Just know that I always say too that CDCS is one of the most person-centered things there is, because it really isn't about the item itself ever. It's about the item in relation to the person. So know that even though something is allowable under waiver or CDCS, that doesn't necessarily mean it's approvable for all. So we always ask the lead agency to apply those basic waiver criteria for allowable expenditures to really look at the item itself in relation to the person. We get questions every day from people that say, can we approve this? Is this something waiver can pay for? And we really rely on the professional judgment of the lead agencies to make that determination, because they, after all, are the ones that have all the information about the person, whether the assessment, the composition of the household, the diagnosis, the other things that are in the plan. So just when people ask us questions, the majority of the time we ask them to consider the basic waiver criteria for allowable expenditures and some of those considerations that are specific to the person, because we do not know the person or the needs. And so this is, whether it's under individual directed services or any other thing, that would be our guidance, that you would be really evaluating the item in relation to the person. Okay, so the next thing is our guidance. We have talked about something like bikes. Now, this is our policy guidance has not changed about bikes. We've always said that bikes are typically considered recreational in nature, and also really an item that is normally provided by the person or their parents or family. Something I would buy a bike for my child or myself, that would be something that is typically paid for by a person. And we have said that even though waiver dollars can't pay for the bike itself, its waiver can be used to pay for modifications or adaptations to that item in order to make it usable and functional for the person due to their disability. So just like a lot of other things, waiver dollars can step in to pay for modifications, adaptations. We pay for vehicle modifications. We don't, the waiver dollars doesn't pay for the vehicle. Home modifications is paying for the modifications to make that environment safe and usable for the person. So the same concept is what we're using here. And there may have been some other guidance that has been provided, but CDCS policy has not veered away from this. This is what we've said about modifications to items that would typically be considered recreational. The one thing that we have said too is that if there's something that's already been modified, that there still could be a portion that the person would be required to contribute. The waivers paying for the additional cost. Next slide. So one thing to keep in mind too when we talk about recreational activities or community inclusion or getting people out and active in the community or participating in a lot of recreational things and activities, just remember that waiver dollars can be used to support the person to participate in the community or in the recreational activities. I think that we focus on the cost of the item, the activity, the event, the class. We focus on some of those things when we have to really keep in mind that waiver dollars is being used to perhaps pay the worker to transport the person because they're unable to drive or get themselves out to an activity. So in CDCS, they're able to pay that worker their time to drive them there, their mileage to drive them there if they can't transport themselves. And the other thing waiver dollars does pay for is that worker's time to accompany that person to the activity or event in the community, accompany the person, stay with the person, support them when they're there, whether it be any kind of support that person needs to fully participate in any kind of recreational activity or community event activity. And whether that be they need physical assistance while they're there, or their speech may be difficult to understand to others, or any vast majority of support that person needs to fully be out in the community, waiver dollars is paying that to support that person. Next slide. So when you think about that same type of concept of recreational activities and thinking about waiver dollars paying for the additional cost of something, this has been challenging. And what we have said something similar to, and we've given this guidance for many years. One example is swimming lessons. And is that something that parent would typically be responsible to pay for? So that is something that a parent would typically pay for their child. However, now you have a child who, because of behavioral issues, cognitive issues, attentional problems, physical challenges, etc., may not be able to be successful in a group standard swimming lesson format, and may need a one-on-one, instruction, or an extra person in the water, or something like that. So what we've said is that that CDCS funds could pay for additional costs because now it's more costly for that person. So that will be applied to other things also, whether it's sports and leisure, craft classes, camp, anything that is modified or adapted or specialized to meet that person's needs. The waiver could pay for those additional costs. When you think about a special instructor, additional staffing, smaller class sizes, some type of an activity that uses adaptive equipment, that all might be more expensive, and so waiver could pay the additional costs of that. So next slide. The other thing, now we have provider qualification. Remember that was something that CMS asked us to do. This hasn't really changed a lot for this particular category, but we have said that individuals or vendors who are providing any type of individual directed goods and services must have all the necessary professional and or commercial licenses required by federal, state, and local statutes and regulations if it applies. Some of this will not apply. We know that people get goods and through Amazon, or it's not necessarily a specific vendor. It may not be something that it even requires licensing or credentialing, but just keep this in mind that when we're talking about other types of things that this has always been in place, that vendor or individual would bill through the FMS under individual directed goods and services, and that vendor or individual would need to be able to demonstrate to the person that they have the capacity to perform the requested work and the ability to successfully communicate with the person. Next. As a reminder, this is another thing that's been kind of confusing. We just want to remind people that we know that we have a lot of requests, and it's challenging for lead agencies to navigate through that and evaluate different requests. And a lead agency can always request input from a medical provider, a specialist. So you want to make sure that whatever item the person's requesting is, hopefully the right fit for a person that just makes sense. That a lot of times people might request something, but it is just something that they think is going to work or be good. And a lead agency could do that if they wanted to request any input, but that in and of itself, does not necessarily mean that waiver dollars pays for it. So we get we see a lot of requests in OT, PT, and different things like that. But just remember that all of those recommendations doesn't necessarily dictate who's funding that item. It still has to meet those basic waiver criteria for allowable expenditures. So that is a guideline we don't want to make it difficult for people. We don't want people to have to jump through all these hoops to be able to get some of these things. But we know too that there's kind of a false sense of security when somebody has something from their, OT or PT or doctor and says, this is what I want. But the lead agency still has to assure that it meets the basic waiver criteria for allowable expenditures. Remember, it's not about the thing, it's about the item in relation to the person. One person, something will be requested and it'll be approved, and for another person, it may be denied. And we do hear a lot of things where people are saying one county approves and one county doesn't, but what people don't realize is that they're looking at two different people. So regardless of county, let's just say they're evaluating a request for a different person. For example, ramps are allowed. Waiver dollars can pay for ramps. That doesn't mean that everybody that is on a waiver will be approved to get a ramp. I know that's kind of a given, right? But the same concept about people focus so much on the item and not so much on the item in relation to the person. Next slide. Questions?
So we actually just have a couple. And I think, let's see, one is really just trying to determine whether cell phone service is the same as internet. If both are considered utilities. And the other question is kind of like, if lead agencies are making professional judgments in good faith, would the lead agency be penalized for making the wrong call? So I guess I can just say that, no, counties, lead agencies do have to use their professional judgment and navigate, all these policies and make their best, the best decision that they can with the information they have. Because again, DHS doesn't have all the information that you all have as lead agencies. And so, of course, you're the ones that make the ultimate decision. And then as far as specific, I don't think we're going to be able to answer details about, this special, technology. We've got a lot of questions here about, well, somebody's using this technology and it requires internet. So if you have a question about what specifically constitutes a utility, or in what's, what specific technology that a person's using that is affected by this, and you have concerns, email us, and that it will be at the end of the slides. We had a couple questions about implementation and when that will be discussed, and we will be getting to that here shortly. And let's see. And then I would also suggest anything about any specific recreational activity that you have a question about. Why don't you email that to us if there's a specific situation? Because again, we did talk about in the beginning that we wouldn't be able to have time to get to the implementation piece of this if we're going to talk about every specific, a bunch of specific recreational activity modifications. And then the presentation would be available. And the reason that you aren't able to access the presentation currently is because it's not live yet. So once it is, the links will work. So we suggest that you save them. And I think got through. Don't see any other questions. So I think we're ready to
Okay.
go to the next piece.
Yeah. All right, Rebecca. Well, you're up next. Community integration and
Yes.
support.
Oh my gosh, yeah. So this is a kind of a new, kind of a fun new one here, new category. So community integration and support, as I said, it's new. And what this is these are for services that focus specifically on successful participation of the person in community membership. Next slide. And these services are intended to help a person to safely live in the community, participate as a member of their community, develop meaningful day supports and community engagement. If the person is not interested in employment support, for example, to improve social skills and community behavior, build relationships, and improve mental health. And next slide. And then this category will be similar in function to personal assistance in that the category is made up of entirely worker expenses for directly hired support. So these would be expenses related directly to workers. So these workers who a person can hire will provide support and training to help a person engage in activities that develop and strengthen their relationships with community members. Self-designed day supports that establish regular connections to community members, to increase their community independent living skills, participate in community events, groups, organizations, clubs, etc., and contribute to their community through volunteer experiences. Next slide. So some examples of this might be that a person directly hires their worker to provide them the ability to volunteer at their local humane society, perhaps, or maybe they're going to build some relationships through a common interest in books at a community book club, or maybe they're trying to build their relationships in their neighborhood, and maybe they can do that by attending homeowners association meetings. But maybe the person, in order to attend a neighborhood homeowners association meeting, or maybe they want to be part of a neighborhood block party planning committee or something, and maybe they need some help with, say, some behavior management or anxiety support to prepare to go into those situations, for example. In these examples, the worker would be paid through the category of community integration and support. The mileage maybe for the person's worker to transport the person, if that was part of the plan, would be paid under individual goods and services, just to explain how that might be different parts of that expense. So things related to the worker, which I think is on the next slide, actually. Yes, it is. So the worker-related costs for their employment would be under community integration and support. And that'd be pretty much the only things that would be under that category. The mileage would then be under individual goods and services, individual directed goods and services. And I think the next, yeah, we're already at questions for this one.
So there's a question, Rebecca, about will this unbundling change the criteria for CDCS budget exception? And there aren't any changes to the CDCS budget exception. This doesn't affect that at all.
Mm-hmm. Right.
The next question. So the next question, Rebecca, is would this cover a cost? Shoot, it just moved. Oh, sorry. Would this cover a cost for activities for support staff to participate, such as movie theater ticket to go with client and the client's friend to see a movie?
So community integration and support category is not for items or goods, and the waiver is still unable to cover tickets to recreational events. Correct, Cindy? So so that would not be covered for the person or their support staff, is my understanding. But it will cover the cost of the staff to provide support for the person to attend. And then the next question, I think you were about this. We've had this one before about ADLs and ADLs.
Yes. Yeah, I'll take it. So the question is, so if a staff person is providing support for ADLs and IADLs, and also community integration supports within the same shift, where would you put those hours in the plan? Really excellent question. This has come up in our previous trainings. And one thing we just want to say is that we know that people that are being directly hired by the participant under personal assistance, we know that part of that job that they're being hired to perform could be something not only just helping them with their bath, but also taking them out in the community or on activities. And that can still stay within personal assistance. And I think it's going to make a little bit more sense too once you see the policy page about community integration and support, because that focus is a little bit different. It's really about helping a person become a community member, and it's not just about participating in activities. So if you have a worker that's working under personal assistance, helping someone with their bath and getting dressed, and they happen to take them on an activity, they do not have to split that up and have some of that shift under community integration and support. So don't worry about that. And I think that as we navigate through this new category, I think it might, make more sense, but we don't want this to be complicated for people either. It really was supposed to be the community integration and support, the focus a little bit different than just getting out in the community and participating. It was really more about being an active member of the community, different than just, going to music in the park. It was a little bit different than that. So, hopefully it'll make more sense too as we move forward, but I don't want people to have to stress out about, is it personal assistance, is it community integration and support? And you do not have to split a worker shift between those two. It doesn't really make sense. But if people have goals that are specific to community membership, then it would go into community integration and support. Can a parent of a minor be paid for this category, Rebecca?
So the answer is that nothing has changed for parents of minors and spouses being paid, which is that, as you all know, the parents of minors and spouses may only be paid under personal assistance category, and that continues to be the case. Employment services.
Yeah. So, I don't know if this is traditional or not, Rebecca. So the question is about the question is about employment services.
Yeah.
And I hopefully I covered in the individual directed business services area that we know that right now anybody that's self-directing through CDCS can use their CDCS dollars to purchase any traditional waiver or state plan home care service, use their dollars for that. Anybody can do that right now. What we are asking people to do if people are purchasing traditional employment supports or any other traditional waiver service, that will fall under the individual directed goods and services category. That's where it will go. So when you're talking about employment services fall under this category, I don't know if you're talking about traditional or just self-designed kind of, I'm not working anymore, or I don't know if it really isn't designed for employment supports per se. Maybe you can submit that to more specifics.
And then there's one here, it says, asking about the habilitation and how that'll be handled about, for DD waiver. So I just wanted to address, so the question was, at times unpaid parent time will be provided to address habilitation needs for their child on a DD waiver. Where would this expense go on the plan? Obviously and she writes in here in the parentheses, obviously at $0. So I just wanted to mention again that the new CDCS CSP is currently in production, and there will actually be a section on this now that will address habilitation specifically. And so we hope that that will be much easier for everyone once that kind of comes out. So I guess the answer to that is that will be coming, and it's going to have its own little extra section. So hopefully everybody will be glad to see that. And then do we have any more questions, Cindy?
Yes, there is a question that is if someone were choosing to self-direct employment services. So, we always give that example of a person that, I don't know, that was wanted to start a little egg business or something and raise chickens. Right? But he needed to hire somebody to help him learn the trade of doing that. So if somebody were choosing to self-direct employment services, so you directly hire staff to work with them as sort of a job coach, and rather than, doing an agency, which category would that fall under?
So what I would say about that is that, unfortunately, we're going to have you wait for that answer when the CDCS CSP comes out. We're hoping that it will have enough information in each of the category descriptions for you guys to know where to put things in your plan.
Yes.
Let's see. Can some of the unanswered questions be addressed in Policy Quest? I think some of them may be in there.
But Policy Quest isn't.
For searching.
Yeah, there's search feature. We'll I think that, as we're doing all of these trainings, we're getting questions, and we do think that maybe, some type of a way to be able to do an FAQ or, something. I'm not sure. Okay, I'm not sure about that yet. But
we'll definitely be saving questions here too and looking at that, possibly doing an FAQ. And then there's a question here about the new CSP expected to roll out. So we're actually going to be talking about implementation next, or really quickly soon here. So we'll keep going, and then hopefully some of this will be addressed as we keep moving. Everybody's got such great questions.
Really good questions, you guys. And I think, Rebecca, I was taking the remainder here.
Yep.
We shifted that around.
Yeah.
Okay, so the next one is an environmental modifications, and this is a home. And as I mentioned, you can go to the next slide. As I mentioned earlier, CMS asked us to separate out home and vehicle. We didn't make any policy changes for this at all. And the next one is vehicle modifications. Just to reiterate that this is a separate category, so we wanted to address it this way. Nothing's changed about that either. There's no policy changes, nothing different about home modifications or vehicle modifications. Next slide. FMS. Again, I mentioned that earlier, that the financial management services is currently under self-direction support activities, and CMS asked us to keep this as or create a separate service category. Next slide. There hasn't been any changes to this category. We just made it a separate service category. So the only thing that will really be in that category is the FMS fees. And the same thing, next slide, is the CDCS support planner. Same thing. They used to be covered under self-direction support activities, and they are now in the separate category by itself. And we didn't make any policy changes for CDCS support planners. It's just in a separate category. So as if you were looking at that visual at the beginning, we have 4 service categories. We have separated them out into 8, and those are the 8 that we just mentioned. So now we're going to talk a little bit about implementation. So when exactly is this going to happen? How are we going to do this? Next slide. So as we do for any implementation of any policy changes, we will send an e-list announcement with the effective date. And I mentioned earlier that all of these service categories has been approved in our waiver plan. This was something that we proposed a few years ago. We had public comments about it. CMS approved the changes, and we've been working ever since to create new policy pages, forms, templates, etc. We will send an e-list announcement that will have the effective date. The one thing that I wanted to say about that is that we have everything really close to being ready to go. But as you know, we are always hesitant to give a definitive date, and that's because things could happen behind the scenes. We have new modifiers. We have some of our e-docs that need to be vetted or published, and sometimes there's snags. And so we hesitate to give an exact date, but just know that it's close. We will, once we announce the effective date, then we will publish all of the updated policy pages, all of the forms, the CDCS CSP template, all of that will be published when we announce this. The other thing too that we have had to update are all of the online learning modules. So as you know, there's a CDCS learning module specifically for lead agencies. There's a learning module specifically for participants. There's a learning module specifically for CDCS support planners. All of those learning modules had to be updated to reflect all of the changes that we just talked about. So there's a lot of behind the scenes work that has been done. We're getting close, but we don't have a definitive date at this point. Next slide. So the way we want to do this is really a rolling implementation. We want this to be the least disruptive to people that are receiving services. It isn't really anything that because we're unbundling these categories, it's going to affect billing, it's going to affect modifiers. None of these things are really things that individuals, they just want to make sure that they're getting their services with the least disruption. So what we are going to do is that we will do a rolling implementation, meaning that it's not going to happen when we announce it. So if we announce unbundling is effective on such and such a date, that doesn't mean everybody has to transfer over to the new stuff. So we want to make sure that this is the least disruptive. We don't want this to also have individuals have to incur any more money as far as using a support planner to update plans, et cetera. So right now, the current participants that are current CDCS participants will just continue to use their current plan because it's already been approved. Everything that's in their plan remains, and everything is, we adhere to and honor everything that they have on their plan through the remainder of their plan year. So for some people, they wouldn't have to do anything for quite a while yet because they may have just started their new plan year. Those individuals will then transition to the unbundled CDCS CSP template, the policies, et cetera, after their next assessment. So typically when an individual is having their reassessment, that's usually when people start thinking about their renewal plan, their renewal CDCS plan, right around that time, a couple months before their new plan begins. And at that point is when we would ask that people just shift over to that new CDCS CSP template, and that support planners then would help them at that time with the new template. So there's just no reason for anybody to have to hurry to do anything as far as people that are in the middle of the plan year. So what that really means that's clunky for like a lot of people is that we really will be consecutively running the old or the current CDCS and CDCS policy and categories at the same time that some people have already have transitioned to the unbundled policy and forms. We just don't want this to be something that people that are using services is going to be burdensome to them. So there's no need to have individuals stop what they're doing and do anything right this very second, because there's just no reason for it. We don't want that to happen. So the next slide, we would really ask that support planners not jump into revised plans at this time if not needed for individuals that are in the middle of their plan year. We're honoring their current CDCS CSP and their approved plan. There's no reason to do anything different until it's time for those individuals for their renewal. And then they will help them at that time to use those updated forms. All right, next slide. There's a lot of stuff, so let us know if you have any questions. Rebecca, what are we at? Rebecca?
Oh my gosh, I was talking away on mute.
Okay,
Sorry.
I thought so.
If a current participant needs to have an amendment to their current plan during their year, but after implementation, will they still be using their old plan and process for their revision?
Good question. That's a really good question. I think that we don't want them to. I think our preference is that if they have an amendment to their current plan, they use their current plan. And the one reason I say that is because we have to also, there's so many things that the bigger picture of this is that we have FMS providers who will be, they're actually submitting claims to all of these things, and we want clear audit trails, and we don't want to have to see one plan and all these items approved, and then jump into the other CDCS CSP template. So proceed. I'm going to say, Rebecca, and you can jump in. Proceed as you normally do for that person until the end of their plan year.
Yep.
Right.
Okay. Yep. And then will the unbundling affect service authorizations? Will those be done any differently?
No, and as I didn't probably, reinforce this, there are no changes to the way CDCS budgets will be authorized on a service agreement. Just like we do now, individuals obtain their individual state said CDCS budget through the waiver management system based on the results of their assessment. Nothing's changed there. They're given an annual budget amount. That budget amount is authorized on a single line item on a service agreement. Nothing's changed with the authorization end. The only change will be on the claim side. The claim side meaning the modifiers of how we're indicating how people are using those dollars and how claims are being submitted. So nothing with the authorization.
Right. Still going to be T2028 in one line, right?
Yes.
Okay. And then another question is just wondering, how will everyone know that that the implementation is rolling out? Like what kind of timeline and what can they expect for notification? Yeah,
so as we mentioned, this is true for any changes we make for some of our policy changes or our announcements. Sometimes we have CMS approval and we'll say don't do anything until you get notice saying on such and such a date or effective today or whatever we say, we're gonna launch or we're gonna start or here's the updated information. just like we, typically would do. So it's not effective today. It's not going to be effective until we have an e-list announcement launching it, right? We have to be able to say, we're going to start the unbundling on such and such a date. Then we have to publish all of the policy pages, all of the new forms, the CDCS CSP template. We have to have the modifiers in place. So just know that, and when you get an a e-list announcement, the expectation isn't that like a whole bunch of people are going to be changing at that right away.
And then I guess there's another question. I think I could probably quickly answer. They're saying, well, if someone's in process of renewal right now, and then an effective date came out, they would have to switch everything that they're working on right now, and that is not the intent, Cindy, right?
No.
If they're in process with
that,
something, the lead agency should accept that, even if it overlaps with the effective date.
Yeah, you just don't want to. Right, and part of that too has to do with the fact, first of all, it's kind of a hassle for people, and the other thing is that they're going to incur more expenses because let's say they're working with, well, they may not because they may be writing their own plan, but let's say they are working with a CDCS support planner, and that support planner maybe already started, working on their plan. We don't want necessarily people to have to incur more expenses just because of something that we're implementing. Right, that isn't necessarily their choice.
Right. And then just to clarify, I've got another question about, is this effective today? No, it is not effective today. And then I think the question is, there's one more question about training modules and when will they be available and where? And I think they're talking about that. We probably should just mention that CDCS training modules for the person and their family are coming. They're not published yet, but we expect those to be out shortly. Correct, Cindy?
Right, and I think the other question is I think in general, people are asking where all this training is. And it's hard for me to just grab a chat or grab links while I'm talking and looking at the Q&A, but the CDCS policy manual has a CDCS resources page, and that page has training currently for CDCS participants and families or people that are interested in CDCS. That is something that people access simply by clicking on it. There's no train link, there's no registration. Just click on it, and there's training available to individuals that are using CDCS or interested in CDCS. That is available. On that same page is the training for lead agencies, and that is through TrainLink.
Yeah, I just said that.
Yeah, okay, sorry, yeah, sorry, yeah. Yes, good, thank you, Rebecca.
Yeah, and I think that might be all we have on that for questions. And then I think,
all right.
Yeah, I think hopefully that, and you did it, again, just to clarify, I see another question here, and maybe it's old and I missed it, but about the rollout. And so these will all be done at their assessment, their person's reassessment, right, Cindy? After the effective date. Okay.
Right.
And then there's another question in here too about unbundling related to Waiver Reimagine. So that one might be a little bit.
Well, I can answer that.
Okay.
I can answer that. How is this unbundling project leading toward phase 2 of Waiver Reimagine with the 4 disability waivers being consolidated into 2? Will CDCS with these unbundled service categories continue to be an option, or are more changes coming? Okay, I'm going to answer that by saying that the Waiver Reimagine project, although one of the goals of Waiver Reimagine is to make opportunities for people to be able to self-direct. We want to open that up to people that are given options to self-direct services. That's part of one of the goals of Waiver Reimagine. It is not specifically CDCS. So CDCS is current, active, something that's been around forever. And part of the unbundling, like I said earlier, came about via CMS asking us to take a closer look at this. So this in and of itself is not specifically or directly related to Waiver Reimagine. I don't know how self-directed services in the future will look once all of all the things that are happening with Waiver Reimagine and consolidating disability waivers. I don't know how self-direction as a whole, as a bigger picture, will look, or if things will change. All we can do right now is follow the guidance of CMS, specifically for consumer-directed community supports, or CDCS. So hopefully that answers the question. It's kind of vague, but that's all I can say, because it isn't, I don't know what it would look like in the future.
Okay. And then we do have a question here, questions about that are elderly waiver specific. So I'm wondering if Dawn will be available for that. Are you still there, Dawn?
I am still here. And I see that one, and I saw it previously. And like Cindy and Rebecca have stated, and specific to elderly waiver, the waiver can pay beyond what medical assistance can cover, but can't pay to essentially replace what medical assistance can cover. And Cindy and Rebecca, could you clarify for me, as far as goods and services, does that apply similarly to as it does for treatment and training?
Right. Yeah. Right, Cindy. I mean, it's the same way for that. Like, we can't, like,
Right.
treatment and
Yeah.
training isn't going to cover things that are already available, because it's meant to be specialized, right? Differently than what's available already. I don't know, Cindy, you want to speak to that anymore?
Yeah, and I think the other thing too, it's not that we're trying to, make things difficult for people, but if they don't have to use their waiver dollars, we want them not have to use their waiver dollars. And so there isn't anything that's changed really, because EW, as far as the waiver plan, has mirrored what we've amended for the disability waivers in relation to unbundling. So some of these things that we're talking about are really just clarifications, because there's just been a lot of confusion about what's available through other funding sources or covered by MA, or, I mean, I think we've taken it to some different levels, and we just wanted to kind of just explain it and clarify exactly what the intent was. And for EW, it would be, it's going to, talking about goods and services, as I mentioned, environmental modifications and provisions, or the provisions part of that category, is now individual directed goods and services, and it's really going to look like what we have now under the environmental modifications and provisions in relation to equipment and supplies.
Maybe might be a good way to say it would be that nothing's changing because of unbundling about what can be covered in that area. It's just, but if you need more clarification or have a specific question, there will be 2 emails at the end of the presentation, I think on the next slide perhaps, where you can reach out to aging through and reach Dawn Clemmer, or you could reach out to disability services for consumer directed support, and that would be you'd be reaching myself and Cindy and Diane Benjamin by doing that. So if you didn't get your question answered or have additional questions, please go ahead and send us an email.
The other thing too, I'm just going to jump in, Rebecca, is we provided just that DFT consumer directed email, and part of that is because if if you're sending direct emails to us individually, we're, you know, not always able to, we may be on vacation or something like that. The other thing, the other preference really is that DST contact form. And that is something that the division as a whole is really trying to promote. And it's part of that triaging of the DST consumer, the DST contact form. It's pretty effective. So if you complete a DST contact form and you call out, you have a CDCS specific question, it really is pretty effective in coming right to us. Us meaning just Rebecca and I, and Diane accesses that too. It's pretty effective. And so we don't want people to think that you can't reach out to us individually, but the preference really is the other. I know it seems very generic and impersonal, but there's kind of a reason for that, and that is because it takes a group effort sometimes, and it's nice to be able to work on some of these things together, and it's easier to track too. So, and for Dawn, they have a similar kind of generic email, and that is a way too for you to ask questions, and that way it's we're able to kind of take more of a team approach instead of just sending it to our direct emails, which I'm not saying you can't, I'm just saying that the preference is this way.
Great. Well, thank you guys so much for joining and participating fully. Appreciate it.
Yes, thank you so much. We had a really big group today, great questions. And I'm appreciative of that too, because it helps us to know too, not just how we're presenting, but how we're clarifying some of our policy, and that'll help us, you know, take another look at our policy pages before we publish. So thank you so much for joining, and have a great rest of your day. Bye.